Lots of people throughout the world suffers from different thyroid disorders. As well as examination of thyroid gland is a must know for any examinee of any discipline of medical science. In this video, I will discuss few things regarding thyroid gland examination. And before going to the main discussion, it's time for front page picture. This poster was made to protest violation against doctors in their working places. Here in Bangladesh, every day we come to know that somewhere doctors have been assaulted in their workplace. Maybe this scenario is similar in many other countries, as well as this scenario may be applicable for other professionals too. So, I demand safety of a professional in their workplace. So I think you guys have subscribed my channel, and thank you for subscribing, and let's begin our today's journey. Thyroid gland examination. A disclaimer. So let's start our journey to know how to palpate a thyroid gland. And you guys all know the thyroid gland is best palpated both from the behind as well as from the front of the patient when his or her neck is in slight extension. So first you ask to extend his or her neck, then go for palpation. And we will start by palpating from the anterior aspect of the patient, from the front of the patient. And you all know the first thing, before placing a hand over the patient or before starting the palpation, you need to ask one thing, that whether he or she is experiencing any pain over that region. Clear? Now, there are mnemonic called 4T. 4T. Okay. So first of all, you know that the palpation starts with assessing the temperature of the swelling. And how do we assess the temperature? We assess the temperature with the dorsum of our hand, and we place in the normal side, then with the swelling over the swelling, then again at a normal side. And in that cases, as the forehead is very close to the patient or close to the thyroid, then we will place the dorsum of the hand over the forehead, then over the thyroid swelling, then again over the forehead. Clear? Then another T is tenderness, and to assess the tenderness we need to gentle press over the thyroid gland, and the look, or my eye will look at the patient's eye, cause it is the patient face or expression which never lies. After that we measure the swelling, okay, with a tape, measuring tape. The third T is for tape, measuring tape. Clear? Another one is tracheal position. We need to assess the tracheal position, and that tracheal assessment is done both from the anterior approach as well as from the behind as well. And then we need to assess the swallowing. We have inspected, on inspection we have assessed the swallowing. On palpation also you need to ask patient for another time swallowing. Then okay, আপনি আপনার মুখটা বড় করে হা করেন, ওকে, এবার মুখে পানি নিন, মুখে পানি নিল, নেওয়ার পরে আমি বলবো যে আপনি পানিটা ধরে রাখেন, ধরে রাখার পর আমি যখন আপনাকে বলবো ঢোক গিলতে, দেন আপনি ঢোক গিলবেন। সো দ্য ডেমনস্ট্রেশন ইজ ইম্পর্টেন্ট, অ্যান্ড যখন সে ঢোক গিলবে তখন হচ্ছে আমরা পালপেট করে দেখব যে হ্যাঁ যেটা মুভ করতেছে সেটা আছে থাইরয়েড গ্ল্যান্ড কিনা। So first of all, we will ask the patient to take a sip of water in the mouth, and then I will ask to hold the water. Then we will demonstrate that when I will ask you to sip or swallow, then just swallow. Then you will place a hand over the thyroid gland and ask the patient to swallow. Okay, then he will swallow the water, and you will feel that something is moving upwards while she swallows or drinks water. Clear? And then you need to go for the get below the swelling. Look at that picture. That picture is showing you that get below the swelling. Your thumbs are below the thyroid gland. and you can get below the swelling. In hernia we assess for the get above the swelling, but as the swelling is above, so we in thyroid examination we need to assess for the get below the swelling. That swallowing as well as that get below swelling should be assessed from the behind again. So again, the temperature, the tenderness, the size of the swelling, the surface of the swelling and margin you can assess from the front. Clear? So let's know how to assess the tracheal position. So that picture is taken from your reference book, Norman Browse, Demonstration of Clinical Science. And they show that they have placed right index and right thumb over the suprasternal notch, and then they have asked to swallow the patient, and they have assessed the trachea is centrally placed or not. But in our clinical practice we usually do it bit differently. We are taught, or we place our right index over the right sternoclavicular joint and our right ring finger over the left sternoclavicular joint, and we assess the tracheal position by using our middle finger. We place the middle finger in between and we assess gently whether the trachea is centrally placed or not by gently placing or gently pressing over the suprasternal notch. Clear, I think? Okay. After that you need to assess for the get below the swelling. Get below the swelling is similar to the get above the swelling is hernia. In hernia we need to go for the get above the swelling. In case of thyroid or in neck swelling we need to get below the swelling. That means whether we can get below the swelling, and that is done to differentiate it from the retrosternal goiter. Okay, and how do you do? It is done, I have told that is from the anterior aspect. We place both thumb of the below the swelling and we assess that he can go below the swelling. And when we go behind, from the behind we just place all the fingers of both hands over the swelling, and by that region we can assess that whether we can go get below the swelling, and we ask the patient to swallow again also. So that patient is informed, or that patient is asked for swallowing for several times. Okay, that can be sometimes bit discomfortable the patient, but keep in mind that we need to see everything. Now, what are the methods of palpating a thyroid gland? First of all, you need to place hands around hand. Okay, hands around hand, both the hands you need to place over there. Then we need to place the thumb, that is this is thumb, and that thumb will be over the occipital region of the patient. Okay, and other fingers will be the front of the patient. Okay, front of the neck, and by using that index and that thumb we can flex the patient neck. Okay, so flex and extend. By using that thumb and index finger we can flex the neck. Clear? That is very essential technique. And also the fingers you see are lying flat, so we will feel with the palms or the flat of the finger. Okay, that's how we usually palpate the thyroid gland. And you see that fingers are flat over the swelling, and that fingers flat we just palpate the both the lobes. Okay, it is a method, Leahy's method, and that method is used if any glands, any lobes of the gland are not clearly palpated. To make it more prominent, we just do what? We just press. Look for, say for example, we are going to assess the left lobe properly. Okay, then we will press gently and firmly also the right lobe with the right hand, right fingers, and we will feel, or we will palpate the surface, the margin or consistency, everything, the left lobe after pressing over the right lobe. Clear? And that method is called Leahy's method. After that you will go for the assessment of the consistency. Okay, so consistency of the swelling is of mainly 4 types, but in case of thyroid swelling we usually find one swelling firm or it can be hard. We know that firm swellings are usually benign in nature and hard swelling are malignant in nature. But there is a term called thyroid paradox, which means that sometimes thyroid can be filled with cyst fluid cavity. We call it thyroid cyst. As thyroid gland is small and it is lined by a tough capsule, so if fluid accumulates, if moderate amount of fluid accumulates in thyroid gland, that swelling consistency can be hard. That means the fluid cavity, that thyroid is containing fluid but consistency seems to be hard. That is called thyroid paradox. Okay. Now we need to go for the assessment of the mobility, and we know that assessment of the mobility is done in horizontal and vertical direction. Look in this video, that is done in vertical method, vertical direction, and now we are assessing in horizontal axis. Clear? So you will hold the thyroid gland and move from side to side and above downwards. That's it. After that mobility we will go for the assessment of fixity. You know, thyroid gland lies deep to the sternocleidomastoid, and the basic of examining a fixity, first of all you will move in a relaxed state. As for example, for the mobility, you will see the mobility. After that you will ask to contract the muscle, then you will assess the mobility again in both direction, horizontal direction and vertical direction. As this thyroid gland lies deep to the sternocleidomastoid, we need to fix or contract the sternocleidomastoid muscle first. For that reason we need to know what does that muscle do usually. So that sternocleidomastoid muscle actually rotates head to opposite side. That muscle usually rotates head to opposite side. Okay, and when both side muscles act together, then usually they do the flexion of the neck and extension of the head. Okay, so how does it do? So that is rotation. Okay, that patient has rotated his head or his neck towards the left side, and that has made the sternocleidomastoid muscle of the right side more prominent. So that is that muscle. Okay, it is become more prominent, and that swelling has become more prominent. Okay, even you see, and you know, to examine the fixity of the swelling we need to give a resistance also. So you will ask the patient to rotate in the opposite direction. Say for example you are going to examine the right sternocleidomastoid, so you will ask the patient to rotate his head to the left side. Okay, then you will give resistance. You will hold his chin with your hands and hold it firmly. So he need to move his head towards left side with your resistance or against your resistance. Clear? And that will make that muscle more contracted, and then you will assess the fixity. Okay, if that swelling get more prominent, that means that swelling is not fixed with the sternocleidomastoid, but in case of thyroid, this is fixed to the or lies deep to the sternocleidomastoid. On contraction of sternocleidomastoid muscle, that thyroid gland will diminish actually, and when you will assess the mobility or fixity, that will get less mobile. Okay, and when you need to assess if the swelling is it is done for a certain thyroid nodule, but if the thyroid is diffusely enlarged or multinodular goiter is involved every lobes, okay, then you can see that you will put your palm of the hand or under the chin of the patient, and you will ask patient to give firm pressure over your hand, and that will contract both sides of the sternocleidomastoid, because when it acts together that causes flexion of the neck. So there are two methods you can. If the swelling is solitary, then you need to ask for rotation of the head and you will give firm pressure or give resistance. But when the swelling is diffusely enlarged or multinodular goiter or involved every lobes, then you can ask patient to put pressure over your hand, which is placed just beneath his chin, and that pressure will flex or will contract both sternocleidomastoid, and that is how we will assess the fixity towards underlying structures. As well as we need to assess the skin fixity, which is usually done by pinching of the skin over the swelling. You will pinch with your with thumb and index the skin over the thyroid. Okay, so that is the fixity. Okay, after that you will look for the thrill, and thrill usually is found in the toxic or diffuse toxic goiter, that is Graves' disease. You can find the thrill, and if you that is found in the upper mid back or at the superior pole of the thyroid actually, because the thyroid gland gives is more vascular supply at that region. So superior pole you will palpate for the thrill, and if you find any thrill, you should auscultate also. You should not, you must auscultate. Okay. Then there are some few other tests which we can be examined, that is Kocher's test, and that test is not done always. Okay, if you find a very small swelling, you need to go for the Kocher's test, and that Kocher's test or Kocher's test is for a hugely enormously enlarged thyroid gland. And how to do it? First of all, you need to ask the patient to extend the neck. Okay, I will make a separate video for this, but for small demonstration, first of all you will need to ask the patient to extend his neck, and then ask to take deep breaths, and ask the patient to open his mouth, and towards the through the mouth he will take deep breathing, so mouth breathing. After that, the examinee or you will press in the one lobe, okay, right lobe, and you will place your ear just in the patient's throat to hear any stridor. Okay, so you will compress the swelling from one side, and the patient will develop stridor, and you will hear with your ear. Okay, that is the Kocher's test. Also Berry's cell means that it is also done in case of malignancy and when the swelling is very enormously enlarged, because if the swelling is not that much enlarged, that you will not push the carotid artery. The Berry's sign is that you cannot palpate or you cannot feel the pulsation of carotid artery at that original site, because the enlarged thyroid gland will push the carotid artery laterally. So we usually feel the carotid pulse at the upper level of the thyroid cartilage, just anterior to the sternocleidomastoid. So thyroid cartilage upper border, at the anterior part of the sternocleidomastoid we usually feel the carotid pulse. But in case of enlarged thyroid gland and malignant thyroid tissue, that will pull that will push the carotid artery, and we cannot feel at that region. It can be felt upper or it can be felt below or posterior laterally also. Okay, that is called Berry's sign. And also you need to examine the thyroid gland, and that thyroid gland examinations, or you can need to examine cervical glands, and cervical gland have got 6 levels: level 1A, 1B, level 2, 3, 4, 5, 6. You need to examine the occipital lobes, also auricular, post-auricular, every groups of node you need to assess. And you know, thyroid carcinoma usually can go to the level, usually goes to the level 5 nodes, and it can also go to the other lobes also. And then you go for the Nafziger signs. Nafziger signs is used to assess the exophthalmos or not, or whether the patient has developed, and it is done from the behind. You will stand behind the patient and look at the supraciliary arch. Look at there. This is the supraciliary arch. Both supraciliary arch. That you will just stand behind of the patient, and your supraciliary arch or eye level will be in similar line with that patient's supraciliary arch. Okay. After that, In normal case, that locus is normal eye. You cannot see any eyeball, but in case of right eye, you can see that the right eyeball is protruding, or that patient is having exophthalmos. So this is Nafziger test. Okay. After that, you will come front of the patient again, and you will go look for the sign of toxicity in the form of, you will examine the pulse, then you will go for the tremor or the thyroid ectopathy. Okay, then you will go for the eye signs. Lots of signs are there, I will describe in a separate video. And you will look for the BRI if that patient is having that thrill, also cardiac examination. Then you will look for the legs for the pre-tibial myxedema and ankle jerk. It is found in hypothyroidism, that there is delayed relaxation of the ankle jerk. And also you ask patient to sit down and rise again for looking at the proximal muscle myopathy. Usually there will be proximal muscle weakness, and you need to percuss. If you cannot get below the swelling in palpation or inspection, then you need to go for the percussion, because that patient may have retrosternal goiter. In that case, usually if you percuss over the sternum, that will be what? That will be resonant. But in the patient is having retrosternal goiter, there will be dullness. Clear? And auscultation, there is the site how to examine the BRI, okay, upper lobe or upper part of the thyroid cartilage. And the findings may be that is found in Graves' disease. There will be low pitched venous hum, and you need to assess the precordium. Okay, precordium also, so heart sounds, so additional heart sounds may be found. So thank you very much. I think I have discussed everything about the palpation of the thyroid. The later things like the thyroid toxicity or the main features like Cocker sign, various sign, I can demonstrate in many more videos. So thank you very much for watching. I think you will subscribe the channel, and if you have any query, you can comment in my comment section. And thank you again for watching thoroughly.